Premier Ford called today's new record high concerning and said nothing is off the table when it comes to further lockdowns. He and retired General Rick Hillier, who heads up vaccine distribution, outlined more details about vaccinations the day after history was made with the first injection in Canada. More vaccines are coming, but still not enough to cover the most vulnerable for some time.
There's hope for everyone out there now, and our challenge is to get more vaccines, which they're coming.
This is what hope looks like. Toronto's first COVID vaccine was given yesterday, and Ottawa's first was today.
1, 2, 3.
This week, 1,500 frontline health workers in each city will be immunized with the first Pfizer shipments, and then they will get their second shot in 21 days. That uses up the first batch of 6,000 vaccines. The good news is more are on the way.
We'll receive up to 90,000 more Pfizer vaccines, and we'll roll those out to some 19 different sites across Ontario, including University Health Network.
The federal government also announced today 168,000 doses of Moderna could be approved and distributed by the end of this month. They'll be critical in the fight to protect long-term care residents and will be sent to their homes starting in the hot zones. Moderna can be transported more easily than the Pfizer vaccines, which need ultra-cold storage. Ontario isn't sure yet how many it will receive.
Once you get a massive amount of doses, how many per day, once this is rolled out, maximum, do you foresee being able to vaccinate?
Thousands, and I'm not going to be more precise than that because I simply cannot be.
It's still a bit of a guessing game, but the provincial government believes they'll have enough vaccines for 1.2 million people in the first 3 months of 2021. But that won't be enough to do all long-term care residents and healthcare workers.
If we total up everybody in those two categories, we have more people, about 1.4 million, than we will have. We'll have more demand than we will have supply of the vaccine. So we're going to roll it out as quickly as possible. It so much depends on the supply, and we remain committed that we will be able to vaccinate as fast or faster than the vaccine supplies arrive to us.
It will be April before the general public can start getting vaccinated. In the meantime, concern is growing as cases continue to climb and hospitals admit more and more COVID patients.
It's really important that people not get together in gatherings larger than their own household. Please, please continue to follow those rules.